Hello, everyone. My name is Rachel Wesenberg. I am a master's in public health student with a concentration in global health. Today, my presentation will be on asylum seekers and access to healthcare. In 2022, there were almost 90 million displaced people around the world. That means that about 1% of the world's population doesn't have a place to call home. It is also estimated that about 1 in 3 adults around the world have not one, but multiple chronic health conditions. These chronic conditions can include depression, diabetes, asthma, and high blood pressure, among others. And managing these conditions is often a lifelong endeavor that can include life-saving medical devices such as an inhaler and daily management tools such as insulin. So, what does chronic disease management have to do with human displacement and migration? I've spent some time considering that during my time working at the Casa Elitas Welcome Center here in Tucson. The guests who pass through the Casa Elitas Welcome Center are people who have entered the United States seeking asylum and have recently been released from detention centers managed by U.S. Immigration and Customs Enforcement, or ICE. When someone is displaced and working through the asylum seeking process, their chronic conditions stay with them and are often exacerbated by the stress of the journey. In 2022 alone, Casa Elitas received over 100,000 guests. We can assume that at least 75% of them are adults, and using the previous estimates, that 1/3 of them have at least one chronic condition. After a little bit of math, that means that around 25,000 asylum seekers may have had one or more chronic conditions that require a medication or treatment. This is significant because many of our guests report not getting their medication returned to them upon release from the detention center. In other words, there's a breakdown in the medical care that asylum seekers receive from the onset of Border Patrol custody through detention centers and on to migrant shelters. It is a breakdown that we seek to learn more about over the coming years so that we can better serve our guests and facilitate effective communication of their needs to relevant stakeholders such as HHS, ICE, Border Patrol, and other state and local actors. In order to better understand this issue, we've put together a plan to collect primary and secondary data in order to provide a summary of the gaps in medical services. To achieve that end, we enhanced our intake questionnaire to specifically ask guests if they have had a medication taken away from them, and we'll conduct a literature review to better understand this issue on a larger scale. It is imperative that work be done to understand the medical care offered to this extremely vulnerable population because migration is not stopping anytime soon. Migration is related to climate change, disaster, conflict, and so many other complicated political, environmental, and social factors. Migration is our future. We need to illuminate the ways that migrants are not being treated humanely in order to improve their experience of movement through the world. Thank you.